Hi everybody, Dr. Garcia from Garcia Facial Plastic Surgery. I'm going to be discussing with you your post-operative instructions for otoplasty. Otoplasty is the operation that fixes the position of the ears. You're going to have a compressive dressing around your head the first night of surgery. The dressing after a while will be annoying and it will be a nuisance. We will take it off early in the morning after the surgery. Once we take that dressing off, there's a few things that you need to do. Your suture lines, or where your stitches are going to be, are behind the ear. There are no stitches in front of the ear with otoplasty. It is all in the crease behind the ear back here. We want you to clean those incisions 6 times a day, the Q-tip using hydrogen peroxide. Dunk the Q-tip into the hydrogen peroxide and then very gently clean behind the ear. Do not, while you are recovering from otoplasty, ever pull your ear forward. You never want to pull the ear forward during otoplasty recovery. So clean these incisions behind the ears 6 times a day with peroxide. After you've cleaned it with the peroxide, we want you to take your Neosporin or your antibiotic ointment or your bacitracin, whichever ointment you happen to be using, and we want you to clean the incision behind the ear 6 times a day with the Neosporin ointment. We also want you to wash your hair once a day, if you can do it twice a day, with baby shampoo. Just rinse your hair, use baby shampoo, wash your hair twice a day. This will again improve the hygiene for the area behind the ear. The last thing is what you're going to be doing with the positions of the ear. We advise you to buy a headband that is not too tight, that's going to fit around your head and over your ears. Again, we don't want this headband to be too tight, but the headband is going to be worn by you 24 hours a day for the first 3 weeks after your operation. Obviously, you take the headband off to do your cleanings or to get in the shower, but we want that headband to be on at all times for the first 3 weeks. After the initial 3 weeks, we want you to use the headband on your ears or over your ears only at night. So 3 weeks, 24 hours a day, and then 3 weeks only at night. By then you will have been fully recovered from your operation. We want you to keep your head elevated for 2 weeks total after the otoplasty operation, and we do not want you to turn your head or flop over on your side for 2 weeks after the operation. And finally, we ask that you do not wear any earrings for the first 2 weeks after your otoplasty operation. So here are your otoplasty operation instructions. Thank you for watching.